What happened to this nose? A promising young actress from China opted for a cosmetic procedure to make her nose look a little bit better, and this is what happened. Hi, I'm Dr. Jonathan Zelken, board-certified plastic surgeon in Newport Beach, California, and I specialize in plastic surgery of the face and body. I feel compelled from time to time to bring up news releases pertaining to plastic surgery when I feel there's some degree of misinformation and an opportunity for people to benefit from a more thorough discussion of what may be going on. So today's topic is an unfortunate young budding actress from China named Gao Liu. Gao Liu is a beautiful Chinese woman who has recently been cast in certain movies, motion pictures in China. And one of her friends apparently made some comment about her nose being too short. Looking at the pictures, I can't see too much of her before, like I can't really appreciate it without filters and in normal lighting, but it looks like she has a really pretty nose even before. Maybe a little bit of an ill-defined tip, maybe a little bit of an aquiline nose where she has a little bit of a bump, but that's really pretty. It's not necessarily unattractive, but it may not fit certain budding global standards for beauty. And whatever it is, she opted to enhance her beauty through plastic surgery, as many people do. That's fine. The story has it, and I'm looking at news outlets and stuff like that. I'm just trying to find, make sense of what I'm reading. It seems to vary from place to place, but the common bond is this. Here's the theme. She goes to Guangzhou, which is in southern China. She chooses to have a 4-hour operation, which sounds like using some ear cartilage to enhance and project her tip. Some articles talk about the transplant failing or being rejected, and other articles talk about an implant being removed in a second operation, but it sounds like things weren't going well. And here's a picture of what I think is from the first operation. The tip looks really red, and so she came back, I guess, within a week and had either the cartilage taken out or an implant. Some articles talk about an implant being removed. Just to clarify, there's no such thing as ear cartilage transplant rejection. If you are grafting your own tissue, it may not take, but it doesn't get rejected. You don't reject your own tissue. So, and then other articles talk about a nasal implant possibly being removed. Looking at the pictures, it's impossible for me to tell, but in the end, I do see evidence of soft tissue loss at the end of her nose. It looks like this was manifest early on in the operation. So what happened here? It's impossible to tell what happened here based on no clinical records, things lost in translation, and trying to decipher news media outlets describing the events that happened. But in the end, she has a black nasal tip. That's called necrosis. And it started out with a reddish purple, this sort of ominous hue at the tip of her nose. That usually comes about from aggressive defatting of the nasal tip. Why would you defat a nasal tip? To understand that, we've got to understand what it is that Asians typically seek in Asian rhinoplasty. Compared to Western rhinoplasty, where we are reducing nasal size, taking out humps, making noses smaller, Asian rhinoplasty starts with a small nose with an ill-defined bridge, a low dorsum, and a round bulbous tip with thick skin plus minus wide nostrils. The common theme in Asian rhinoplasty is to project the tip, to give a taller dorsum, and to give more contour to a nose, plus minus reducing the nostril width. That's probably what happened here, and ear cartilage was chosen as the implant material of choice to enhance the nasal tip. If you defat the nose and you're putting something underneath it to project it, you have really insulted the blood supply, especially if you don't really know what you're doing. And that, at that point, probably irreversibly led to the outcome that we see here. I've written a lot of papers on Asian rhinoplasty, and I understand the importance of the limitations that we have to face. In a single operation, you can only do so much in the way of projection. So aggressive defatting while trying to over-project a tip is a recipe for disaster. In my practice, I tend to be a little bit more conservative with defatting insofar as not to cause compromise of the blood supply to the nasal tip. In addition, it's really important to understand that that thick skin envelope is something that we address by overbuilding the internal construct rather than defatting to get some better contour. And last but not least, if and when this happens, you have venous congestion or things like that, there are things that we can do early on, like removing stitches or putting something called Silvadene on your nasal tip to prevent worsening of the injury. So I'm not sure what was done, if any or all of these were done. It sounds like the surgeons may have known what they're doing, and it may be unfair for the media to condemn them as not being qualified. But this patient, unfortunately, will suffer losses of potential opportunities during the time that she was being treated, the months, and her beauty will forever be compromised by her decision to enhance her nasal tip a little bit. If you have a hole in the tip of your nose, the cure for this, and there is a cure, is fairly drastic, and it may even involve recruiting tissue in the form of a flap from your forehead to fill in that hole. If you know somebody who's going through this, I'd be happy to see them. I would love to treat this patient herself with the understanding that it is not a quick fix. So if you are deciding to enhance your features, especially beyond the limits of what your body wants to do, really consider these possible risks. I think this is a big warning shot to everybody considering cosmetic surgery that these things can happen. Make sure that you consult with a qualified, board-certified plastic surgeon who specializes in this and understands the nuances of particular ethnicities and understands the desires and goals and can be realistic with you in terms of a surgical plan and setting your expectations. I hope this video helps, and this is what I think happened to Gao Liu.